slides? Yeah, great. So it's really nice to meet everybody. I really enjoyed those introductions. Thank you for sharing. It helps me get an additional bit of extra context in terms of who you are and where you're coming from. My name is Natasha Martin. I work at UC San Diego. I am an infectious disease modeler. And so today I kind of want to touch on three things. I'll tell you a little bit about who I am and where I came from. Also, one of my roles here in terms of my academic service at UC San Diego is to be part of the Department of Medicine's Committee on Appointments and Promotions. So I spend a lot of time looking at people's academic files and thinking about them. So I know you've had some talks on this. I wanted to reiterate what you've heard and just give you a little bit of my personal experience in terms of the academic file review process and how to make your file as strong as possible, thinking about your academic and professional advancement. And then I added a couple slides this morning about the peer review process. Another part of sort of professional service that I do is I'm the associate editor for 2 academic journals. So I thought I'd talk a little bit about what I've learned in that process as well. So hopefully you'll find those things useful. Please feel free to interrupt me if you have any questions while we're going. I'm not good at monitoring the chat, so just unmute yourself and please interrupt. Okay, so just one kind of slide to introduce you into what I do. I am a mathematician by training, and I consider myself an infectious disease epidemic and economic modeler. There's a lot of different types of modeling and modelers. What I do here is kind of shown on this slide. I try to develop simulation models to predict the trajectory of disease epidemics. So here you can see a model that we built to simulate HIV transmission among people who inject drugs. And here this is in a rural setting in Russia, Ekaterinburg, where you can see the epidemic has increased and expanded quite a lot in the early 2000s, has reached very high prevalence, 60% of people who inject drugs infected with HIV. And what we want to use these models to do is try to understand and predict what is the future trajectory of these epidemics, what is the impact of if we scale up different interventions. And the economic piece is really what is the best value for money in terms of how we allocate our resources across multiple different prevention interventions. So the aim of this is really to inform policymakers and decision makers in terms of how they should approach and how they might most effectively and efficiently prevent disease and long-term health consequences associated with that. So within that sort of broad area, I have a particular kind of topical focus, and that is improving the health among underserved populations. A lot of my work is among people who inject drugs. I have done some work among men who have sex with men and transgender women, as well as female sex workers. So very interested in improving health among those populations, particularly among substance using populations, and we often have overlapping risks in those groups. I tend to have done most of my modeling looking at HIV transmission and prevention, as well as viral hepatitis. And I'm very interested in structural drivers of risk. So thinking about how policies such as drug policies and criminalization of drug use can lead to and fuel infectious disease transmission. And more recently, as Jeff mentioned, a lot of the infectious disease modelers in the world have been shifted their focus slightly to COVID. So I am not unique in that. And I've been doing quite a bit of modeling, both at the county level among counties in California, as well as at our university in terms of thinking about how we can use modeling to more effectively tailor our decisions in terms of what we close and how we close and open, and how we inform our prevention and testing strategies for COVID. So I'm one of the co-leads of the UC San Diego's Return to Learn program, which is sort of trying to prevent COVID transmission on campus and use a data-driven approach to our decision-making. Okay, so I'm American, as you can see, but in my academic career has taken me sort of cross continents, and I'm now a dual citizen between the US and the UK, but I was born in Chicago. And I knew from a very early age that I wanted to go somewhere with better weather. And I feel like I've progressively, over the course of my career, migrated to places with better and better weather. So that's been nice. So I started my academic career at Stanford University, moved out to California. I actually originally wanted to be a biology major. I thought maybe I wanted to do medicine. I was always very interested in health. I'm not really sure why. I just really was drawn to disease and wanting to improve human health. And so I started by taking a lot of biology classes. And to be perfectly honest, I wasn't that good at them. I really struggled in some of my biochemistry coursework. It just wasn't the best for me. Within the biology major, there were some mathematics classes, and I always found math was a little bit easier for me to do. So I kind of just ended up taking more math and continued taking biology classes, but not really knowing where I wanted to go with that. And it was actually one of my undergraduate professors, math professors, that approached me and asked me if I was interested in doing mathematics research. And as an undergraduate, I knew I was interested in research. I thought maybe I'd want to go into academia. I will confess that both my parents are professors. My mother is a professor of evolutionary biology and physical anthropology, and my father is a professor of communications and rhetoric. So I did come from an academic family. I thought maybe I'd want to go on an academic route, but even as an undergraduate, I had no concept of what mathematics research meant. And so when my professor approached me and said, "Are you interested in research?" I said, "Yes, but I don't know what that means. What would that entail?" And he said, "Well, what are you interested in?" And I said, "Well, the truth is I'm really interested in biology." And he said, "Okay, well, that's great. We have some faculty members here that do mathematical biology, where they use mathematical tools and apply them to biological systems. Maybe you're interested in that." And so I said yes, and I started working with a professor who was very interested in leukemia and blood cancers. And she was developing a model of chronic myelogenous leukemia and immune system interaction. So it was a cellular model of how these cells interact in the body, and thinking about how do we best deliver drug treatments and drug therapies to prevent cancer spread. And so I started working with her on that, and I was hooked. It was exactly what I wanted. It was sort of taking my sort of quantitative skills in mathematics and applying them to a medical problem. And that was I knew from the beginning that was exactly what I wanted to do. So I worked with her as an undergraduate and knew I wanted to do a PhD in a kind of a related field. But I wasn't sure where that was going to be. And I actually moved up. I started my doctoral work at University of British Columbia in Canada. There was a very, very famous mathematical biologist who kind of founded the field, actually. And she was working at University of British Columbia, and I went to work with her. And the truth is, it just wasn't a good fit. It wasn't a good fit for me in terms of mentorship. What I didn't realize is she was sort of winding down her research program, and many of her students were actually kind of thinking about having co-mentorships with other mentors, because she was just kind of, finishing up her career, and it wasn't the right fit. So I started my PhD there in September, and by December I went home for Christmas break, and I was feeling a little bit discouraged. I just didn't feel like it was going in the right direction, but I wasn't sure what to do. And I certainly was thinking that I was going to stick it out and just make the best of it. And it was actually my father that said, "I can see you're really unhappy. And if this isn't a right mentorship fit, then you shouldn't spend the next 5 or 6 years of your life in a program that's not the right fit for you." And so I asked him what he suggested, and he said, "Well, I think you should leave." And at that point, I was thinking, "Oh my God, I'm 1/12 of the way through this. I've already done 2 months. I'm not going to quit now. How could I do this? Where am I? What will I do?" And he said, "Figure it out. I'm sure you'll be able to figure it out. We support you. Find a better program. Drop out. Apply to other places. Don't be afraid to change course." So I went home for Christmas, and I never went back. I contacted my mentor. You know, I felt awful, but I said, this just isn't the right fit for me. I'm sorry. She, of course, wouldn't have wanted to spend another 5 years with someone that didn't want to be there. So she was happy that I at least kind of let her know. And so it was January, mid-year, and I had just dropped out of a PhD program. And I thought, okay, well, I'll just apply to some programs that are still accepting PhD students right now for the fall. Is really what it was. So there aren't some, you know, many of them close their application cycle in September. So I looked around at a few, and one of the few that was open was Oxford. Now, I had been aware of Oxford. They have a very big mathematical biology program, and I had not applied there the first time around because I wasn't thinking of going over to Europe. But then kind of thought, why not? Why not give it a try? And so I applied in one of their later application cycles that kind of had a later cycle, and I sent an application in. And I did, you know, want to explain that, you know, I didn't drop out because I'm a horror graduate student. It just wasn't a great fit, right? So I was invited for an interview, and I flew there in person. And because I wanted to have a conversation face to face to kind of explain what happened. And so that thankfully worked out. And I started at Oxford in the fall, and it was the best decision I ever made. I think one of the best decisions I made was to drop out of my first graduate program and find a better fit for my second one. And it was a scary point. I think there's a lot of points in your career where you can make decisions like that, and it's scary to make a change. But I think it was a really good lesson for me to do that, and gave me a bit of confidence in the future. So I did a PhD at Oxford. It was on modeling tumor biology, cancer progression. I was looking at breast cancer progression. I really loved that. But during my PhD, I kind of felt like I was working with experimentalists that were doing mouse models of tumor growth. And I thought it was fascinating, and I really was interested in cancer. But I also just felt a little bit that what I was doing they were going to cure cancer with or without me. That is not to say that I don't think the field is hugely important, and there are many people in that field doing really incredible work, but I just felt like I wanted to have maybe a little bit more of a population, broader impact. And so when I finished my PhD, I very conscientiously decided that I wanted to use that mathematical training and apply it to disease transmission at a population level to really have a public health translational impact. So that was a bit of a topical shift, but the mathematics is the same, very similar. And so I started looking for people that were in that area. And I was just looking online at researchers, and I found a researcher that was at the London School of Hygiene and Tropical Medicine. And he had been working simulating HIV epidemics in many global settings. I knew I really wanted to have kind of global research, and I really wanted to potentially have the opportunity to work in the field. It was, my mother does a lot of anthropological work in the field. She had worked for many years in Tanzania. And even as a mathematician, I thought, well, maybe I can get involved in a research project that's embedded somewhere, and I would love to have that experience. So I contacted a professor at London School of Hygiene and Tropical Medicine and said, I would love to get into this area, and I would love to work in the field. Are you taking postdocs? And he said, I am taking postdocs, but I'm taking a postdoc for somebody working in the UK on UK research, and you would not be in the field. And I don't usually send people in the field, but if you want to do this, this is the opportunity. And so I took it. And it ended up being a great decision, because I was able to work with him on a project related to hepatitis C. And then when that project, although it was the UK based, when that research area and that project became of more global interest, he had already had this existing global network of collaborators and funders that knew of him. And so I was able to transition that into working in a lot more international settings, and in fact, working in the field, which I'll talk about in a second. So that was great. And that was really because I was working with a mentor that had that existing network that he was able to pull me into when the time was right and when the project was right. So in the UK, the system's a little bit different than in the US. Postdoctoral researchers often spend many years as postdocs before they transition to faculty, and that's accepted. And once you get a faculty position, it is tenured and it's permanent. All faculty positions in the UK. Well, the vast majority of faculty positions are tenured and permanent in the UK. That's not the case at every institution, but many of them are. So it's okay to kind of spend a bunch of time as a postdoc, which I did. And then I was, for personal reasons, wanted to come back to the US. I was pregnant. I was thinking about, wanting to be a bit closer to home. When I had gone to Oxford, I had not envisaged spending 10 years in the UK. I thought I'd go there for my PhD and then come straight back. So I was looking for opportunities to come back to the US, and I ended up here, being recruited here to UC San Diego, where now I'm an associate professor. So I skipped that assistant professor route, partially because I'd done that 5 years of postdoc in the UK, where I kind of built that academic portfolio, and I'll take you through that in a minute. And so now I'm here at UC San Diego. So I would say, I just wanted to say one thing about that early research time as a postdoc in terms of how I made the transition from national to a little bit more of a global focus. I mentioned that I relied quite heavily on my mentor who already had this global network. That's true. The other thing was really that it was luck and timing in terms of my research project. So I started working in hepatitis C prevention in 2009. This was before the new, you may be aware that there were new hepatitis C drugs that became available in kind of 2011, 2013, that were incredibly effective at treating the disease, much easier to take. So I started working just before that in hepatitis C, when people weren't that excited or interested in it at the time, although there was interest within the UK. Then these new drugs came along. Everyone got excited about hepatitis C. And then the World Health Organization, which I'm showing you here, in 2016, released their global health sector strategy on viral hepatitis elimination, which set these 2 elimination goals: to reduce new hepatitis B and C infections by 90% by 2030, and to reduce deaths by 65% in 2030. So when the World Health Organization issued these elimination targets and elimination strategies, it meant that countries started paying attention. And it went from a handful of countries, mainly high-income countries that had the resource to kind of think about viral hepatitis and hepatitis C in particular, to many, many countries wanting to think about hepatitis C, wanting to understand what their epidemics looked like, and committing to these elimination targets and wanting to know, how do I achieve these targets by 2030? And was really pivotal for me in order to take my research to kind of a global setting. I had been developing these models looking at hepatitis C elimination for the UK, and we were able to very quickly expand and start applying them to other countries and meeting people and making connections that way. So I'm sure you've heard this already. Nothing really innovative in this slide, but really thinking back in terms of how I built my international research network. I think I was facilitated by living and working in the UK, in which the UK was sort of highly connected already to the European Union at the time, and other European countries. And so they often would group together in terms of applying for grant funding. And so I often was working with other European countries. And then from that, it kind of spiraled outward in terms of other low to middle income country settings that my collaborators and our network partners were working with. But the first thing that I would say is just to go. Especially, I still do it, but especially in that early part of my career, I said yes to everything. I went to every conference I was invited to, if I could, every workshop, every meeting, and I went in person. I often would fly just for a day to go in person, and just to meet people in person. I felt like that person-to-person connection was amazing, and especially in that early part of my research career where people did not know me, I took every opportunity to go and speak about my research, publicize it, even if it was in a fairly small and informal setting, to let people know who I was, what my skill set was, and that I was willing and interested in working with them. So I went to things as much as possible in person, and really did not say no unless I absolutely had to anything. I still like to do that. To kind of
So
make.
I think that's a great point, Natasha. But I mean, it seems like for international researchers, I mean, that takes resources, it takes chutzpah, it takes, a lot, so how do they more practically do that? And let's not get into the Zoom thing, because hopefully this won't be Zoom forever. But I mean, what can they do in terms of as international folks who don't have necessarily the same kind of resources?
Yeah, that's a great question. So often I would ask for funding. So often the workshops and the meetings have a little bit of funding set aside for people that don't have the resource. So if they ask you to present, I would be, absolutely ask for a resource to attend and travel resource to attend. Conferences often have grants that you can apply for in order to attend, especially if you're coming from a low to middle income country settings. And your academic institution will often have very small travel seed grants to attend things like conferences and workshops that you can apply for that can help provide that additional funding. So this is really sort of bits and pieces of pulling together research funding, as well as asking your mentor. Mentors often have, and so it's kind of, and sometimes, you can get your mentor can cover maybe the accommodation, and the workshop organizers can cover the flight. So piecing together bits and pieces of resource, I think, can really help in that setting.
But I think it's a good point. I mean, you really have to put yourself out there. And, this is the kind of field where, you're mostly an independent scientist, but, you have to build your own, scientific networks and collaborations and get your skill set and reputation and expertise kind of known in the field. And, just submitting manuscripts is not sufficient. You have to be a face at conferences. You have to ask questions at conferences. So, personally, that was kind of one of my strategies early on, is I was always up the microphone, and they're like, oh, here's that question from Klausner again. And, you're not trying to necessarily show how smart you are, but you're just trying to show that you're listening and you're present. And, that was just a small, practical thing you can do once you get to the meeting. But yes, you make a good point about trying to cobble together different resources from different sources. It's often, one entity can't fund everything, but someone can fund the travel, someone can fund the registration, you can get reduced registration. But when we get back to some, life 2.0 and those open up again, I think that's really a valuable opportunity. Thanks.
Agreed. And Jeff, to your point in terms of what you do when you get to a conference, by the way, everybody hates kind of going to a conference where they don't know anyone. It feels awful. You don't want to interject yourself in a conversation. Everyone seems to know each other. The way I manage that, I think asking questions is great. Introduce yourself when you are at the microphone, so people know who you are. Say where you're from. Ask your question. It is nice to phrase it in terms. Again, yeah, it's not necessarily trying to show that you're smart, but just that you're thinking about these issues. Maybe ask a question that can open up the presenter to discuss about a new thing or an alternative area, or add on to their research. And then going up to the presenter, if it's someone that's in your field and particularly of interest to you, and just introducing yourself at the end of the session, even if you don't have anything, that you specifically want to say, but just to introduce yourself, that is great. The poster sessions are fantastic. Go walk around the poster sessions, introduce yourself to people there. People do often, even senior people often stand by their posters. And so that's a less intimidating way. Often after talks, people are swamped and there's thousands of people there, but in the poster session, it's easier to get time and FaceTime with people. And same thing, if you're presenting a poster, be there to present. People are often around there, and that's an opportunity for them to see you and for you to get a chance to present your research. Those are all great things. And now often many conferences and workshops have sort of networking sessions or drink sessions where you can go and just mingle. And again, it's just a bit of getting over that first fear of not knowing anyone in the room, but really important to do, I think. And then after you sort of make that connection, of course, really investing time, and you all know this because you're doing this, right? The value of investing time in a country and actually really getting to understand what the local issues there are, what are the local questions there. This is exactly what the GloCal Fellowship is about, and I think is so one of the best learning opportunities in terms of international research, is the importance of understanding the local context, what the local needs are in terms of what they care about, how you can direct the questions to their research issues, and thinking about how to build local capacity. My longest term collaborations have been places where I've developed networks there and built and worked on building capacity and research there so that it could be sustainable for them. And then that's just meant that our collaboration has sort of extended longer. And again, these are all things you're doing within within the GloCal Fellowship, which is fantastic, and continue and encourage you to continue to do that. So as I mentioned, when I was in the UK and working at the University of Bristol London School of Hygiene and Tropical Medicine, a lot of my research was on hepatitis C. And so it was focused on the impact and the cost effectiveness of hepatitis C prevention. And I was working, in Europe, many European countries, Australia, but then I actually did get to do some field work in Myanmar, as well as in the country of Georgia. And that was really when the global shift that I mentioned occurred, where there were a lot of low to middle income country settings that were thinking about hepatitis C elimination. And finally, I got to actually go out in the field and collect cost data and be both in the field as well as behind my computer doing the simulation. So that was great. And then since I've come to UC San Diego, my methodological focus has broadened. So I see myself as a very, as a methodologist. I'm a modeler. I can apply epidemic models to a lot of different things. And so I've branched out doing more work in HIV, hepatitis B, hepatitis A, syphilis, now COVID, and overdose. And so I use these simulation models. I'm now applying them to more different diseases, but also applying them to a lot of other global settings. And so I have, for example, an NIH grant where we're simulating HIV prevention in 108 countries. Of course, I'm not going to all of those countries, but 9 of them we're working in 9 key countries. We're working in country with collaborators, policymakers, key stakeholders there, work with the data, work on the questions, and really have that that formal kind of in-depth research collaboration. And so that's really great, and has taken me, across a lot more global settings, which has been great. Okay.
Natasha?
Yeah.
I just on how you went about setting up the collaborations. Were they specifically with people that your mentors knew, or people that you had published with, or how did you reach out and start these networks?
That's a great question. So early on, what happened was people came when, as I mentioned, the WHO had their elimination strategy, and people came to us at conferences because they saw that we were doing modeling to inform what the UK and what European countries needed for hepatitis C elimination. And so, for example, Georgia, the country of Georgia, wanted to develop an elimination plan, and we had that collaboration was formed at a conference where they saw that we kind of had the methodological expertise that they needed for their program. And so they reached out. Often this has also been through larger, so just to back up, yes. So a lot of it has occurred because, as I mentioned, I sort of put myself out there. And so part of it was advertising our methodological expertise at conferences and at workshops. And when people were having their local or regional meetings, then on thinking about hepatitis C elimination, they were thinking, well, we need a modeling component. And I tried to say yes to those meetings and go to those meetings to say, we're not working in your area, but we could do this. And this is something we could apply to your area. And then some countries had that expertise in-house and said, oh, we have a modeling team, we can do that, great. Most of them at that time did not. And so they were very keen to build that collaboration once they knew who we were. But it was the knowing who we were. And I think it came more from people had seen our papers in the literature, but again, it was more from being at conferences and being out there. A little bit of that was from existing networks that that my collaborators had. So one example is that we had a very large project with Unitaid that Médecins Sans Frontières, Doctors Without Borders, was running. It was a hepatitis C testing and treatment program across 7 countries. He had been working already with MSF looking at HIV, and so they knew of him and they called him. So a little bit of it was personal connections with these research groups that transitioned from HIV research into viral hepatitis research, but quite a lot of it was, as I mentioned, kind of going to conferences, going to workshops, and just getting our name out there. And some of it has been sort of cold email introductions, I have to say. So laterally, and the way that I've done this is, for example, for the current grant that I work on, we wanted to choose these 9 key countries that we're validating in countries that have the highest burden of HIV infected people who inject drugs. So one of those countries was China. We wanted to work in China. I didn't have a network. We didn't have an existing collaboration there. And that was kind of actually just reaching out, finding who the right person would be in terms of the surveillance data and sending email introductions. And that did work. I don't think that necessarily always works, but that did work in that case. So it's not always through people that we know. It has been just kind of contacting people. And I think if you have a good reason and an interesting project and aligns with their interest, then they're very often keen to be involved, especially if when it's a multinational collaboration and they can see that, they're one part of a larger research project. I think one of the things we focus very much on when I make that pitch in terms of working with new key countries is that we want to tailor the research to their country settings. Without their voice, we may be asking the wrong question. And so really reaching out and appealing to that in terms of, we want you to guide what questions we're asking for the research to make sure they're right, is great, because that's what they want as well, right? They want to be able to actually provide guidance and input in the study and make sure that they care about the results at the end. And that is the truth for what we're doing, because often you can develop a model and answer a totally an irrelevant question depending on what the local policy is and the local capacity is for policy change. So that tends to be the reason why people want to work with us, that sort of research guidance, as well as the capacity building. So I mentioned that one of my roles here is that I look at academic files in terms of their progression. Now, this is slightly different at every institution, but I think the 4 kind of main areas that tend to be looked at in terms of academic files are the same. So pretty much wherever you are, I think you're going to have a part of your file that will look at your research. That's your publications, that's your grants. A part of your file that looks at your teaching. This can be formal teaching, either if you're a clinician, it can be your clinical teaching or your classes, but also incorporates mentoring. So mentoring of graduate students and fellows. There's a component of clinical work if that's relevant to you. I'm not a clinician, so I can't speak to that. And there's a part usually about service. That service part is both service to your university. So are you on university committees? What kind of things do you do within your universities to support operations there, as well as outside professional service? So, an example of this is, do you review papers for journals? Are you a journal editor? Do you help organize conferences? Things like that. Do you kind of just help kind of professional activities and external professional things going on there? And in addition to those sort of 4 main components of research, teaching, clinical, and service, Okay, so the expectations within each domain depend on your university. So your university will have different expectations. Within the University of California, even the UC system, the expectations will depend on what series you're in. So are you in a clinical series, or are you in an adjunct research series? And so, if you're in a clinical series, there is more emphasis on your clinical activities and slightly less emphasis on your research, for example, although you are still expected to have some amount of activity in all of these domains. But the amount of activity depends on the series. Across all series, they expect you to see the development of national and international recognition. They want to see evidence that you are becoming, increasingly known for a specific research area or methodological expertise. And the evidence of this can be in the form of invitations to speak at conferences, invited speaking engagements, keynote lectures, invitations to organize conferences or chair sessions, just some kind of acknowledgement in terms of that the research field knows you and is aware of you and recognizes your specific research area. And then especially for that really critical transition from the assistant to associate professor, they're looking for research independence. They want to see that you're transitioning from a mentored research to an independent researcher, and that is in the form of papers where you are first or senior author, where your mentor is not first or senior author. So your mentor can be on those papers, but not in a senior authorship role. You're really taking the lead on those papers. And the other way that people show evidence of this is in obtaining grant funding where they're PIs. So you are the principal investigator on a grant and you obtain the funding yourself. Those are two really critical ways. So these are the sort of critical components, I think, to an academic file. Really quickly, I won't go through this in detail, but just to kind of take you a little bit through how I've built my academic file. So I mentioned I started and did 5 years of a postdoctoral fellowship in the UK before I moved back to the US. And so in that time, I really focused, and most people really focus on their research, building up my publications and my grants. In particular, my publications were kind of building this methodological research area of modeling hepatitis C elimination. That was really what I did a lot of my work in. And for grants, and I obtained a postdoctoral fellowship as PI, so I showed that I could write a fellowship, had gone through that grant process, could obtain it. Many people in the United States obtain their K awards in this period. And one thing that I think was important for my international research is that I also obtained a few little grants, like grants from pharmaceutical companies to do research. And I got exposure to writing different types of grants and pitching them to different funders. And I also my mentors were very good at bringing me in as co-investigator on many larger grants, for example, to Unitaid, the World Bank, government grants in different governments. And it gave me the exposure to kind of see the different styles of grants when you're pitching it to different funders, and B, what these larger collaborative international research grants look like, where you're just one piece of a larger puzzle. And so that was really good exposure to me to kind of just see what those grants looked like and that they were on my radar in terms of other funding that you could potentially apply for, especially collaborative research funding. Then in terms of teaching, I did a bit of mentoring of doctoral students. At that time, I didn't do any really university service. That's something that you tend to build more as when you're in a faculty position. And one of the things that really transitioned my movement here to UCSD and also from postdoc to associate professor was that in that transition, I applied for an NIH R01 grant. So I was a postdoc in the UK. I knew I wanted to move to the US. The best way to do that is to obtain your own research NIH funding and sort of start with funding that's there that can build your research portfolio. So I actually applied for my NIH grant when I was in the UK. And I was able to obtain that. And so I moved to the US with a newly active NIH R01 grant that was based in Mexico. I was very interested in UCSD was recruiting for an infectious disease modeler, so they were looking for somebody with my area of expertise. I was also interested in working in the San Diego, Mexico border region, so kind of used that to think about how I could build a research grant based on that specific experience and data here and leverage that new setting in terms of my research. So my first R01 grant was in this Mexico border region, and I was a co-PI on it with PIs here, with Stephanie Strathty, who's done a lot of work in that area in terms of epidemiology. And so I was using the modeling based on her epi. And then have followed that on with another R01. I mentioned this kind of global research, but of course, the US wants to see at US institutions, they want to see federal funding most countries, wherever you are, want to see that you're able to get their own federal funding. But one thing I wanted to point out is that a lot of my continuing sort of research collaborations and my burgeoning ones and my smaller ones are really also funded by patching together money. Like we were talking about in terms of patching together money to go to conferences, patch together money to work to start the seeds of these international research collaborations. So that's been through pharmaceutical grants, small grants, large grants and small grants from other governments that have funded international research collaborations, like in Australia. Fogarty has given a bit of money, just seed money to help with some international research. The Center for AIDS Research at UCSD, there are many Center for AIDS researchers that fund international collaborations. I've kind of like looked everywhere and continue to kind of think about foundation funding, other government funding, other, small bits and pieces to patch this research together, and to, as you were talking about, Jeff, to kind of fund to even just go and spend time in those countries and make those connections to apply for larger research grants. So having a diversity of portfolio funding is really important.
Yeah, I just want to echo that. I'm going to have to sign off in 3 minutes. I'm giving a talk half past the hour. But, I think what a good theme here is, being proactive, always saying yes. And then, starting small. You never know where these projects are going to go. And, often, a couple $1,000s here or there, it could just be a small pilot project to collect data, to get some collaboration going. And funders are looking for these collaborations and are looking for pilot projects. So it's kind of like the idea, no project is too small, and no project is too large. And it does take a lot of your own self initiative. And at this point, is in people's careers, is early career, transitioning to early career, postdocs, et cetera, doctoral candidates. It's a lot about, the belief in yourself, and a lot about, people always come back to me about this like imposter syndrome, and like, am I really worth, collaborating with others? Am I really going to get my own idea forward? And you do have to believe in yourself, and, that will carry you far. And it's not about being narcissistic, it's not about being egotistic. It's about just having the self-confidence in yourself. The work you're doing is important, and being able to be kind and collaborate with others. So I'm going to sign off on that note. You're in great hands, and I'll see you guys soon. Thank you, Natasha.
Thanks, Jeff. Yeah, that's great advice. Okay, so I've also expanded my teaching portfolio now that I'm here at UCSD. I guest lecture, I developed a modeling course, and continue my mentoring, and thinking both about mentoring students and having them, making sure that they advance to the next stage in their career, which is really important. And the university wants to see that. So what happens to the people that you mentor? Not just did they finish, but did they go into academic positions, or did they go into the position they wanted, maybe in non-academia? And that, that evidence that you're mentoring and that those students are going to good places and going where they want to go is really important. In terms of service, as I mentioned, I do these academic file reviews. I'm also on the COVID monitoring committee. So this is something where you just need to kind of ask for service opportunities. This is a checkbox, right? Just do a little bit of service, don't get too overwhelmed with it, but show them that you are committed to your university and doing something. And then externally, I mentioned I'm the associate editor for 2 journals, Addiction and International Journal of Drug Policy. And I'm also a vice president of the International Network for Hepatitis and Health for Substance Users. So again, these are kind of organizations and journals in my area, research area. And that it helps to build my network as well, kind of being involved in that, seeing what's published there, as well as who participates in this network that I'm vice president of. So just a few quick tips on your promotion file. This is a pain, but definitely update your CV. And at the University of California, we call it your biographical bibliography as you go. It's so easy to forget little things you did, a talk you gave here, a student you mentored there. And when you're kind of do this every, 5 years later, you're likely to have forgotten something. Mostly that's what we pick up on, is people forgetting all of the things that they do. So try to keep that updated. There's usually something called a self-assessment, where you kind of summarize yourself, who you are, your key achievements. And people often forget to do the summarizing of the key achievements. They get into the deal, they tell everything that they've done. The biggest mistake that we see are that people don't provide the key summary information. How many papers have you published? How many have you first author on? How many grants do you have? What's the total of those? How many students have you mentored? And often it's just like this huge narrative exposition without pulling out the key elements that the people reviewing your file need to see. Of course, you want to provide a bit of detail, but detail in terms of the key highlights. Here's my overall metrics of everything I've done, and let me provide you a little bit more example of where I've, a really interesting research finding that has changed policy or changed clinical management. That's sort of the structure that you want to go for. And then as part of any academic promotion file process, you need to have external referees. And this is a hard part, because you want someone that knows, that is, aware of your research, that's gonna write that you're amazing, that you have this national, international recognition, but it has to be somebody that you haven't published with. So actually thinking strategically at this point in your career, don't publish with all of your friends. Meet people at conferences, great. Save some people that you don't publish for, that you can then ask for recommendations later on. Think about people that have invited you to speak or have come and asked you questions after your talk and are maybe senior to you, right? These referees need to be senior mentors in the field, and keep those. I keep a list in my book of those people that could be eligible for writing me these files. And sometimes, I strategically say, okay, I will not invite that person to be a collaborator on this paper. Obviously, if it's a research project, you need them, great. But, to try to keep a few of these in your back pocket as you go. And then really quickly, I know we only have like 1 minute, just about the publishing process. So when you're choosing a journal, because I mentioned I'm an associate editor of 2 journals. When you're choosing a journal, consider the target audience. Who do you want to read your paper? Not just what's the best impact factor journal in your field, but who do you want to read your paper? And is it in the content area of the journal? That's the most important thing. And then when you're preparing your manuscript, follow the author guidelines. Each journal will have a style, they have a word count that they want and some stylistic preferences in terms of how the manuscript is formatted. Do pay attention to those. Do follow that format for your journal. Check if there are additional forms that they need, signature forms, before you submit it, because if you aren't paying attention to that, it's just going to get sent straight back to you. So do that first. Submit your manuscript. That's a pain. It can often take a long time to go through their online system. So give yourself a bit of time to do that. And then your manuscript will be reviewed. When you are, as an editor, this is what the process looks at. Your paper will first be read by a senior editor, and they're reading your cover letter. So make that snappy. And they're looking through your paper, and they're looking mainly for things like, is your paper interesting to me? Is it timely? Is this something that we care about right now? And is it relevant to the people that are reading my journal? Right. And that's why you want to pick a journal that it's, relevant to that readership and it's of interest to that readership. If the editor can just desk reject it and say, nope, not interested, not interesting, timely, or relevant, not reviewed. Or they can assign it to an editor and say, yeah, I think this should probably be reviewed. And it's important that it's clear what your methodological and topical area is from your cover letter, so they can assign it to the right editor that has expertise, because it's this sub-editor that's going to choose your reviewers. And you want that editor to choose your reviewers wisely. Now, editor will choose request reviewers. They may send it to the people that you recommend. Some editors do not and purposely avoid that because they think they're your friends. They don't want to send it to your friends. There's a lot of differing practice. They will usually never send it to the people that you say, do not send this paper to. Where they also look for reviewers are authors that you cite in your introduction and your discussion, other authors that you cite, other authors that have written similar papers, or other authors that have published in that journal on similar topics, because they know that they're kind of engaged with that journal and they may accept that review. Then it'll get sent out to reviewers. Hopefully they accept. The editor will make a decision. Reject it, use bad, revise it. They may send back out reviewers for another review if they feel it needs to be seen again. That process can happen a few times. Or they may just say, revise it, but I'll read it. I'll read your revisions and I can accept it. So that whether it goes back out to the reviewers or back to the editor for the final decision is at that editorial discretion. And then hopefully you go through a few, round of revisions and then accept it at the end of it. So I think the most important thing here is to make sure that you're submitting to the right journal so that both, the editor is in that it's deemed of interest, but also that they can get the right reviewers. This whole process just goes haywire if you aren't submitting it to the right journal. It's not quite the right match. They're not finding the right viewers. They are the right to review, and really helping the editor in terms of guiding them to the people that you want to review by having the people, I would say, citing those people in your papers is really helpful. Okay, and so finally, I just wanted to acknowledge my funders and also acknowledge that I'm a parent too. I have 2 small kids. I have a daughter, Coletta, who's 6 years old, Sebastian, who's 4. I have, unfortunately, no great wisdom to impart in terms of how to balance your professional and your personal careers. It is hard, especially with international research. I do a lot of traveling. I have a spouse that's very supportive and willing to take care of the kids when I need to go to these meetings and build my international collaborations, and it's really hard. There's no really great time to have kids. Every time is an awkward time, but I love them, and you just have to push forward and try to balance as much as you can. And it's a struggle. That's all I can say. But I think there's increasingly acknowledgement that there are the competing demands with parents and trying to understand. For example, there are research grants at my institution that fund being able to bring your children with you to international and national meetings if you need to, and fund childcare for them at those meetings, so that you don't have to not go to a meeting because you need to be at home taking care of your children. So I encourage you to look out for funding opportunities like that if they're available, in order to facilitate your academic career as well as your personal. Sorry, I've gone a few minutes over. Thanks everyone for their patience. Any questions?
Yeah, thanks so much, Dr. Martin, for the wonderful presentation. It was very informative and we all learned a lot. I just want to be respectful of all of the fellows' times, knowing that they have other things that they want to get to. So I'm going to ask the fellows to skip the traditional Q&A just for today. But if they have any questions or things they want to bring up, would you mind if I share your email with them all and they can reach out to you?
Please do. Please send an email.
Okay, perfect. So thank you again, Dr. Martin, for presenting, and thank you to all the fellows who were able to attend this presentation. And I will send you all an email and share Dr. Martin's email so you can reach out to her if you have any questions.
Thanks so much. Good luck, everybody.
Right.
Have a great day. Thanks
Thank you,
for your
everyone.
time. Okay,
have a great
bye.
day. Bye-bye.